All right, so welcome everybody. My name is Camille Dieterle. I'm an associate professor here at Chan, and I'm also the program director for our new graduate certificate called Foundations in Lifestyle Redesign. So that's what this information session is all about. So we'll jump right in. So this graduate certificate is designed for occupational therapy students or occupational therapists who want advanced training in lifestyle redesign. And it will prepare students to be able to design and implement lifestyle redesign interventions with a diverse client population base. So lots of different types of clients. The certification fulfills the coursework requirements to be eligible for the certification in lifestyle redesign. So this is a little bit confusing. So I made another slide about it as well, just to make sure we get it clear. So we are talking about the graduate certificate, is what this information session is about. And through that certificate, you can work towards certification. So similar words, kind of confusing. So the certification, there's 3 categories of requirements: coursework, which you can complete through this graduate certificate, practice hours, and a certification exam. So the graduate certificate is really just this coursework part. If you do the graduate certificate, you would still have to do practice hours and an exam after completing the graduate certificate. We're going to be launching this certification in fall 2024 and making big announcements and having a website and everything about it probably in spring 24. So we still have a ways to go. But something else that's kind of exciting about our certification is that it will enable OTs to use the name Lifestyle Redesign in your promotional materials, which is something that is not currently permitted. So having the certification will give you a lot more freedom with that. So let's go back to the graduate certificate now. So you could complete this graduate certificate in your 1-year master's program. It's a minimum of 12 units, and you use your elective units in fall and spring. And then just a side note that the certificates follow a slightly different schedule. So they actually start 2 weeks later than your other classes. It's just a minor detail. This is your required course sequence. And the graduate certificate will fit into these highlighted units here. So here's what the course sequence looks like for the graduate certificate. In fall, you would take OT 619 and OT 578. And then in spring, you would take 2 of those top 3, 550, 551, or 552. And then you would take 638. So on this slide, the yellow highlights represent required courses for the graduate certificate. And then the 3 that are not highlighted, you choose 2 out of 3. You actually do technically have enough units to take all 3 of 550, 551, 552, but you don't have to in order to get the graduate certificate. So this next few slides are just course descriptions with a little more detail about what these courses are. 619 is a very foundational course. You learn the history of lifestyle redesign. Where did it come from? What are the different theoretical frameworks and principles that informed lifestyle redesign and became a part of it? It's really this kind of core course that helps you learn how occupational therapists can use this intervention to help clients manage chronic conditions, or maybe even prevent chronic conditions. So it's kind of a general, it's the general principles that apply to all populations. 578 is mostly focused on motivational interviewing and other therapeutic communication techniques that assist you in doing lifestyle redesign. One of the things that we end up doing a lot in lifestyle redesign is working with people who are in various stages of readiness for changing their life. right? A lot of chronic health conditions require challenging lifestyle changes, and sometimes our clients are in different stages of readiness. This class helps you learn techniques to help people move along on that continuum of change, to get ready to change and then actually make changes in their life. These next three go very diagnosis specific. So pain and headache management is going to address basically any or all chronic pain diagnoses. And also there's a special emphasis on migraines and headaches, because here in the United States, there's such a high incidence of migraines. We get just so many clients coming with those that we've developed a whole program for it. So this is the course where you can really hone in on specific interventions for chronic pain, and you'll learn the kind of physiology and medically specific content knowledge that you need to work with those clients. The next one, OT 551, is weight management and related conditions. Related conditions refer to type 2 diabetes, hypertension, heart disease, other metabolic disorders. Those are kind of some of the most common. A lot of people who experience obesity also have things like depression, sleep apnea, chronic pain, other things. So sometimes those comorbid conditions come into play as well. So that course goes into detail about how to help someone change their life in terms of weight, blood sugar management, blood pressure management, those types of things. 552 is neurological conditions. There's a heavy emphasis on multiple sclerosis and Parkinson's, and there'll be some other diagnoses discussed in that course as well. And then I didn't make a slide about 638. I'm just realizing that. So if we go back to this last class, OT 638, it's called Mentored Practicum. This is where you will have, you'll find either in your life, like with your friends or your family, or if you're in any kind of clinical placement, you'll find at least 2 people to be your clients, and you'll walk them through a lifestyle redesign intervention throughout the semester. And you'll get mentorship from our faculty. So your faculty who's assigned to your 638 section will be mentoring you throughout that process. So you'll get a lot of feedback about how you're doing lifestyle redesign. Okay, and then our admission is really simple. It's really straightforward. We're creating a link on the Chan website. That link will go live in June. I don't know the exact date yet, coming soon. You'll receive an email notification that will direct you to this link. And then we really just need your name, your student ID, and then you indicate which program you're in. Since you've already applied to our post-professional master's program, we have all the information you need. It's really just kind of signing up. So next up, I'd like to answer any questions you have. So I'm going to stop sharing this now, but who has questions?
Hi, good evening.
Hi.
I actually had a doubt. So this is Manasvi here from India. The doubt that I had was what would be the type of job requirements that we would be looking at after completion of the course? And like when you said the OT 639, the mentorium practice. So I wanted to know also, like from you told we had to find out 2 clients. So where do like we are supposed to find client, or will they be assigned to us, like um
Great. These
I
are
mean
great questions. Thank you. So for 638, I'll start with your second question first. For 638, you will need to find your own clients. So, so sometimes that could be easy. Maybe you have some friends or family. So hopefully that won't be a problem, but it will need to be 2 different people. And then for your first question, I think you're asking what kinds of jobs might you be using lifestyle redesign? Is that
Yes,
okay?
yes.
Yeah. So a lot of times a job won't necessarily say you must be proficient in lifestyle redesign, but it might say something like working with clients with chronic conditions. And in a way, chronic conditions are so common that it may not even really say that, because it's sort of a given in a way that clients have chronic conditions. So let me give you an example. Let's say you're working in an outpatient adult type setting,
Mm-hmm.
and somebody comes in for like rehab, some sort of rehab, like physical rehab. Oftentimes clients will have other diagnoses that are related. So let's say the person is having knee pain or shoulder pain, but they're also obese. They also have hypertension. They also have headache, right? They might have these other chronic health conditions where their daily life, their habits, their routines, their lifestyle really makes a difference with their diagnosis. Or maybe you're working with someone with multiple sclerosis who is not really managing things very well. Maybe they haven't, they're struggling, and so they're not able to do all the things they want to do. So you could use lifestyle redesign to help that person just become more intentional about their everyday habits and routines to support their health and quality of life. You can use lifestyle redesign with such a wide variety of situations and diagnoses. But it's especially when the diagnosis is chronic in nature, meaning that it's not going to just
Mm-hmm.
resolve in a matter of weeks.
Right.
And yeah, and then habits, routines, daily choices are making an impact on the client's goals.
All right. Adjoining to your like my previous question. So as you mentioned, it could be any of the relatives. So like as we are coming like without a background to the US, like I do not have any family circles or let's say friends who are already settled in the US. So for me, if I want to go and find the client base, so where do I look out for patients? Because being new to the area, it would be kind of difficult to just approach some patients and ask them if we could help
Yeah,
them with
that
their
would be
lifestyle.
that would be a little bit strange. So I would recommend telehealth. So you could use Zoom. Lifestyle redesign fits well with telehealth format.
Oh, all right. Yeah, true. Okay. All right. That's it, I think, from me. Thank you.
Thanks for your questions. Any other questions? You feel free to write them in the chat, or you're welcome to unmute and speak your questions. Okay, so Cindy has a question. Thank you. So there's been ongoing certification courses, but the certification will only be available in the spring of next year. So no, so this graduate certificate is brand new. We're just starting it out. This will be the first cohort of the lifestyle redesign graduate certificate. And then the lifestyle redesign certification that I mentioned towards the beginning, it's brand new as well, and it hasn't even started. We're going to start that in fall 2024. That is a new thing. So I'm not sure what you're referring to. And did I answer your question?
If I can jump in, Dr. Dieterle, I
Yeah.
think it might also be the case where some students have taken a CE course previously.
Ah.
And so do the CE courses also can those be combined with the graduate certificate courses, or is that a separate track?
So it is a separate track. So our older continuing education course that's related to lifestyle redesign was called the Life Management series. That has been sunsetted, that has been closed. But if someone did take the life management course, there is some overlap, like some of the same content that was in life management will now be in the graduate certificate, but the graduate certificate has a lot more content and it's a lot more in depth. All right, any other questions?
Hello,
Hi.
I'm Benny from the Philippines.
Nice to
Good
meet you.
day. Yes, I would like to ask something regarding this program. Like, would you say if I were to be an OT interested in the physical dysfunction practice setting, would you say this would be beneficial in terms of like um uh providing interventions?
I think it could be very beneficial for a lot of phys dis settings, but I will give you one exception. The acute care setting where you work in a hospital and you only see someone for maybe 2 or 3 days, maybe 1 week. I would say lifestyle redesign is a little bit, if that's the only thing you're doing and you only see someone for a few days and then you never see them again, you probably wouldn't be able to do that much lifestyle redesign, because a typical lifestyle redesign intervention, you work with the patient several times over weeks and months, and it could be even years. Typically, the most common lifestyle redesign interventions occur over months, maybe 1 month, maybe 4 months. So if you're working in a setting where you only see clients for a day or two and then you never see them again, it would help you. I think it would inform you, but you wouldn't be doing the full lifestyle redesign intervention. Does that make sense?
Yes, of course. Thank you so much.
Any other questions? Okay, so we got another question. What is the job outlook for occupational therapists in the field of lifestyle redesign in the United States? What fields do they work in? So I would say it's common in an outpatient type setting with adults. And it's kind of like what I was saying before. If you work with clients with chronic conditions, you will find lifestyle redesign helpful in basically any setting. Right now, I'll share a few just really specific examples. Right now I have a former student, a past student, who is using lifestyle redesign with people experiencing cancer. Once they've stabilized from a surgery or from their radiation, they are often motivated to just get healthier overall to support their recovery and support their remission. So she's doing lifestyle redesign exclusively with people with various cancer diagnoses. Like I mentioned before, we have a lot of clients we've worked with chronic pain, migraines, but any type of chronic pain. And then a lot of hospitals in the US have weight management programs. And so occupational therapists can be the professionals implementing those weight management programs. Sometimes it's in collaboration with other disciplines. So is that answering your question? And I'll add mental health as well. So in a mental health setting, as I'm sure you all know, when people are trying to improve or manage their mental health, all of their daily habits and routines make a big difference. So things like sleep and physical activity and nutrition and meaningful activity. So a lot of our students who end up going out into mental health use lifestyle redesign a lot as well. So another pediatric application is working with parents. So it's difficult to do lifestyle redesign with young children because they don't control, things like the food they eat and who's going to drive them to what place and all of that. But you can do lifestyle redesign with parents who are trying to, change various family and child habits and routines. You can use this intervention with parents as well. All right, any other questions? Thank you for all these questions.
Ma'am, sorry. Additional question to that. Would that mean if it were to be applied to parents, would that mean it is concerning kids who are mostly on musculoskeletal conditions or?
Not necessarily. So it might be behavioral conditions. It could be like here in the United States, we have a lot of children with diabetes and metabolic disorders, obesity, that kind of thing. But definitely behavioral as well.
Oh, I see. I see. Also, I'm a bit shy to ask the question, but in the United States, what is the most commonly practiced or more profitable, I guess, in terms of like practice setting in the United States? Because I'm wondering choosing between lifestyle redesign and sensory integration, although I am not new to the SI or SP um, therapy because I do practice here in the Philippines. So I'm guessing if I can try to grab the lifestyle just so I would be able to like go back and forth between the two.
Yeah, that's an interesting question. I'm curious if Catherine has input on this too, because I don't always know everything that's happening in all practice areas of OT because I'm highly specialized in my sort of narrow field. But my impression is that there are a lot of pediatric jobs in the US. That's probably our biggest job source. Would you agree, Catherine?
I think that is definitely a popular practice area that especially new grads enter into. I like to say that as OTs, we're all trained as generalists. Here, especially in the United States, when you're being licensed, you are expected to be proficient with clients across the lifespan. And what is more profitable and beneficial in terms of financial gain towards your career as an occupational therapist really does depend on um, not only the practice area, but the type of setting, and also the funding sources of that setting and what state you're in. Because not only does medical funding and insurance costs kind of vary from state to state, the coverage, it also in the end, when we're thinking about how much money actually ends up in our pockets, we need to consider also state taxes as well. And so that is variable across the years, but for our new grads, definitely pediatric settings, outpatient adult settings or long-term care facilities are also very popular. And for many of those who do not especially have a strong affinity towards one practice area, might start off as a travel therapist as well, which I have heard can be quite lucrative.
Skilled nursing facilities also pay very well.
Yes, yes.
Yeah.
I will say, having taken some of the courses when I was in the entry-level master's program towards in regards to lifestyle redesign, including the therapeutic communications and the foundations in lifestyle redesign course, and later entering practice as a school-based pediatric OT, I really did use all of the skills that I learned, not only in those courses when working with the clients, but also like Dr. Dieterle mentioned, it really comes into hand when you're in IEP meetings, speaking with parents, try to transition, like maintain that change that you're making in the classroom at home as well, and supporting the parents, supporting the teachers, because really it's when we're in peds, it's really the whole family, the whole care team that we're working with.
I see. Thank you so much for your answers.
You're welcome. Any other questions? All right. Well, thank you all for attending today. I look forward to meeting you when you get to LA. I'll see you around.